mothers in America should not need a podcaster to get their kids to the right care. When she called to confirm the appointment, my friend in Miami is booked for the next year. When I have a child who fails an MCHAT in Virginia, and I want a behavioral pediatrician to see him, it takes 2 years to get an appointment. In those 2 years, that child doesn't receive any care. Every month that they don't receive care means an additional $200 to $300 in expenses to the health system. When I have a child that needs a speech therapist, no, not a speech therapist, a talk therapist that does CBT, in Northern Virginia, if you don't have $180 to $300 in your pocket to spend every week, you won't find one. When I have a child that I don't know what their mental illness is, but they're not normal, you can't find a pediatric psychiatrist. Pediatric endocrinologists, pediatric infectious disease, pediatric orthopedic surgeons, pediatric, you name it. They're so underpaid, and they spend 15 years to be able to help me when I have a patient I can't deal with, that we are denying care to our children right and left every day. And this is not what a kind Judeo-Christian society does for its young.
Right.
The lack of payment is affecting access to every child and every pregnant mom in the U.S., and we cannot stand for this anymore. We need to wake up and make this a priority.
I bet you if they paid with a credit card or a check or cash, they would get a psychiatrist tomorrow.
If they have the money.
That's the problem. That's the catch-22. I got a message from a new grad fellowship trained pediatric psychiatrist that's looking to rent space for his all cash solo practice. All cash, no insurance.
You can't blame them.
Yeah, but the problem with that is that they can't survive in some areas of the country.
Yeah.
They can do it in more affluent areas, but the areas that need the pediatricians most, they could never survive. There are numerous people that I can think of that have tried doing that in the New York area in the past, in particular, a group of surgeons, and they lost so much money and so much revenue that they went back to signing contracts with managed care companies.
Now, I always wondered, Herb.
That's not true in psychiatry. In psychiatry, they do med checks at $150 a med check, and they're doing $500 an hour, and they're doing very well because there's no one else. And that was the exact same. That's a wonderful analogy because Kennedy moved mental illness out of a broken system, which was abusive, and they never funded the community-based psychiatric services. And then they went and did what they are doing now with nurse practitioners and physician assistants, which was work at the top of your license. A psychiatrist does not need to do talk therapy. They manage medications. And what happened? Now you can't find a social worker, a psychologist, or a psychiatrist that will see your kid when they're depressed for therapy because it was never funded. We never paid for it. So if you don't have cash, you're out of luck. And that's a system that is being built out in pediatrics. Only the top 10% who have cash will see pediatricians if we don't address the payment problem.
So I guess that's where you mentioned the devaluation of pediatric care in your article, Dr. Sutter?
Exactly.
Yep.
And now with a bigger issue is the push for the CMS is basically trying to push value-based systems, which could save money if they are addressed properly. The problem is the metrics that are being used are incorrect. They don't address pediatric issues at all. They were never designed for pediatrics. If they were, there would be a big change.
There's always this talk about this value-based care, okay? I've gotten pretty good at understanding it. The metrics are not unreasonable. If you really look at the population, you'll find people don't get their flu shots. You'll find people don't come in for their checkups. You'll find that adolescents don't get their HPV vaccines. They don't complete their primary series of vaccines by 2 years of age, and so forth and so on. And Herb's favorite BMI metric and all that kind of stuff.